So we're live.
Yes, we
I'm,
are.
I'm Shula,
Hi, I'm Nicole.
and welcome to the Business Therapy Center Live.
Yay!
We've had a little bit of
Finally.
technical challenges today.
Yes, today we're going to be talking about this idea that normal people don't struggle with mental health challenges. We're going to bust that. We're going to talk a little bit more about that.
Yeah. Uh,
We have thoughts.
well. First of all, what's mental health anyway? Like,
Yeah, so I loved your definition. We chatted a little bit before we went live, and I kind of loved the way that you kind of parsed it out into different categories. So I would love for you to share that with the audience.
okay. Well, like I I prefer the term mental well-being, mental and emotional well-being. Uh, and for me, that occurs along a spectrum between doing really well, right? Like really thriving and feeling good, experiencing joy and pleasure, being able to to move our projects forward, to do what we want to do in life, to the other spectrum of I've got a severe and persistent mental health diagnosis under the Diagnostic and Statistical Manual, and it really impairs my capacity to experience joy, to function in life, to do the things I want to do. So, it, in my opinion, it occurs along a spectrum, and it has to do with not only our emotion but also our cognition. So, like we can experience, that's why I like to say mental and emotional well-being, because there are cognitive aspects to this spectrum of mental and emotional well-being,
Yeah.
like mindset, let's say, the way we think, in addition to mood issues on this spectrum.
Mm-hmm.
um, like, what do you have to add? How would you like to amplify that?
No, I agree with you. It is a continuum and it's different for everyone. I can, for many people I've worked with as a therapist, when they feel like they're having a good day, for them, a good day looks very different than someone else. And so I think that the challenge is when we try and lump everything into one definition, even as you just described, there's a continuum and it's different for everyone. It includes different components, not just your mindset, um, and how you view things, the lens in which you view the world. There's also the cognitive aspects. I can have a really positive day and have shit cognition. Like there's different.
Good, but your thinking might not be where you want it to be. Yeah.
Exactly. And so I think it bears kind of pulling apart these definitions and the way that everything gets clumped together. When someone says, "Oh, you're having mental health issues," well, is it, as you said, well, is it well-being? Is it a challenge around feeling where you would like to be on that continuum, or is it a diagnostic? Like, is it an actual diagnosis that requires a trained professional to help you with an intervention, even medication, those type of things. So if we could just start to define and describe these things in the terms in which they really are, I think that's part of busting that myth around mental health and what it is.
So would you say then that it's normal? Normal?
Oh
So
my gosh, yes. It's absolutely normal. And we were talking earlier, and I mentioned that it's so interesting that when it comes to talking about our mental health and our mental and emotional well-being, that there's more of the stigma around what that should look like, and that if we're looking at physical health, we don't automatically look at that your body is just illness, like it's just illness. I'm not describing this very well. So we won't look at our. Go ahead.
You said was your body's not just a body when you're sick.
Exactly.
So it's like we, in theory, anyways, should be attending to our bodies in wellness and in illness.
Yes.
Yes, and so the same. I'm assuming you're thinking the same with our mental and emotional well-being.
Yes, exactly. And yet there's this difference in how we look at it around, there's a stigma around that there's something wrong with you and that it is not normal to be on that continuum at any point. And so that's why this definition of mental wellness and mental well-being, emotional and mental well-being. I love the way that you described it as being on a continuum. There's these two parts to it, and that it is normal to be on that continuum at any point.
If you're not on the continuum, you're basically dead, right?
Exactly.
One of the things that I say in all my talks, and that I like, it's one of my primary messages as far as like, what does this have to do with business? What does mental health have to do with business? I say that mental health challenges are inherent in entrepreneurship. Mm-hmm. Because really, honestly, what you've just said is mental health challenges are inherent in being human.
Yes.
They're an inherent part of the human experience.
There.
If that's the case, then all the more so when you're in business because of the nature of the work, right? It's stressful and demanding work, and we're the only ones, we're wearing all the hats and the only one holding the big picture for the whole of the business. Mm-hmm. And that just by definition makes emotional and cognitive demands, right?
Yes.
And when
it does.
demand is high, capacity decreases. Mm-hmm. And then that places us along the spectrum of we're having more or less challenge to our mental and emotional well-being, depending on the demands that are occurring. And exactly. Again, in business, demands are very high.
They are, and you're often very much alone in that, meaning that you have to defer a lot of your own mental well-being and pursuit to try and hold the whole of it. So it can feel very lonely as you're going through that process. And, we've talked about this before here, we've talked about this before together, that, a lot of the research that I've done around, childhood trauma and entrepreneurship is oftentimes you're going into your endeavors as a business owner or entrepreneur with some core wound at the beginning of it, or, kind of embedded into the foundation of using that business to feel some different way about yourself, to see yourself differently, to try and prove something, to gain control, which is a big one. And so when that's at the core of this pursuit of, I want to feel differently and I'm going to use my business to do that, that plays out in all the facets of your business, including where you're at on that continuum, because the birth of it started from a place of feeling less resourced.
Yeah. So there are a couple of things to amplify what you're saying. What I have observed is that's been ongoing. And then with the pandemic, what I've noticed and what I've seen being talked about in the business, not the research literature, but in on business, like Forbes and all the, Wall Street Journal and things like that, is the experience people have had when they were sent home during the pandemic. Suddenly they experienced much better mental and emotional well-being, mm-hmm. because they were outside of and able to identify toxic work environments that had an impact on their mental health, and particularly folks with disabilities, folks who are racialized, mm-hmm. and folks who had mental challenges to their mental and emotional well-being outside of the work that the work exacerbated. Mm-hmm. But then they came home and all of a sudden discovered they were free from the environment that made that did not, I don't like the word accommodate, did not take into consideration, mm-hmm. their needs. And so then when they were called back to the office, they were like, a lot of people, and especially racialized women, were like, well, fuck that shit. I want an oppression-free workplace. And the only place I can have that is if I create my own business. So that's what I'm going to do. Yeah. And so along with the trauma adaptation, right, that it becomes the thing we do to survive, mm-hmm. which isn't to pathologize it. It's actually to recognize the strength it is, that this is our strength. We've created our strength in our businesses as trauma survivors. Mm-hmm. Then also there's this additional group who may also have experienced trauma as a result of their oppression, mm-hmm. and trauma or not, have experienced mental health impacts of oppressive workplaces and are creating their business as their strength, their strong response, for themselves. Exactly. And then a third factor, there's a psychiatrist and psychologist in the US. His name is Michael Freeman, Dr. Michael Freeman. And he's the guy everybody cites online when you talk about mental health and entrepreneurship. He is apparently the first researcher to have done
Mhm.
research in around 2015.
Mhm.
And his research identified that entrepreneurs come from a pool in the general population who are predisposed to mental health challenges.
Interesting.
Yeah. So we have these three factors, right? The trauma strength, the oppressive, the strength of like our response to our experience of oppression and creating freedom for ourselves. And then
Mhm.
we have this factor of like, of that a significant proportion of us are predisposed
Mhm.
to mental health challenges. Like, it's clear that mental health, mental and emotional well-being, and entrepreneurship are intimately connected.
Yes, they absolutely are. They absolutely are. And, you know, I wonder, I always continue to wonder, you know, why, as entrepreneurs and business owners, there's this fear to give yourself every opportunity to thrive within this, you know, creation of yours. And I think that again, that stigma of what it means to focus on your mental well-being, it's in, you know, there's this narrative that it's indulgent or that it means there's something wrong with you if you want to look into this. And that fear of being seen as, you know, there's that shame that comes up around it. And yeah, I don't know where I was going with that thread.
Well, I'm appreciating what you're saying about the stigma, right? That there is a stigma around mental illness, around having a
Yes.
diagnosis.
Mm-hmm.
And so even to situate yourself on the continuum puts you in relation to people who've been
Yes.
diagnosed and who appear crazy, who
Mm-hmm.
are frightening to others,
Mm-hmm.
right? Who appear, who are like, it's unfamiliar. We feel uncomfortable in their presence. We don't know how to respond, right? And we just would rather, like we do with elderly folks as well,
Mm-hmm.
right? That and differently folks with disabilities.
Yeah.
That we're uncomfortable about it, so we like put it over there, and to situate ourselves on a continuum that connects us in any way with the folks we feel uncomfortable about,
Mm-hmm.
we're like not going to do that, right?
Yeah. Yeah.
I mean, on the one hand, we can look at that and be all sneery about it and like, well, what's your problem? Like, why don't, like, you're biased and prejudiced against these people. But I like what you're saying about, like, from our heart of heart, from the heart of hearts of folks who are thinking this way, it's fear,
Mm-hmm.
right? And like, who, when feeling fearful, would not want safety,
Yes.
right?
Exactly.
So it really comes it comes out in a way that on the surface is hard to connect with.
Mm-hmm.
Might want to like judge, but underneath it is, you know, I've been afraid, you've been afraid. We can connect with the sense of like somebody's afraid,
Mm-hmm.
and understand, relate to that desire for safety and what people will do, what I have done
Mm-hmm.
in order to feel safe in the past,
Yeah.
right?
Yeah.
And I think that's what stigma is about,
Mm-hmm.
is ultimately people are afraid and want safety. And so they
Yeah.
stay away from what scares them.
Yeah, and as you describe it that way, you know, it's not, that's a pattern that we see in a lot of different places, not just with
Yeah.
this one topic. So,
Yeah.
you know, is this one topic stigmatized, or is it just a pattern of stigmatization about a lot of things that if we have fear of it, we don't want to be too close,
Yeah.
you know, to that thing. So,
Yeah. Yeah.
yeah, as you describe it, I'm like, okay, well, why wouldn't someone actually act like that or do that thing? You know, why it's for safety purposes.
Yeah. I think
So,
also it's not well understood.
mhm.
Um, Mental illness or the continuum of mental and emotional well-being is not well understood generally. And so because it's in your mind and we have this belief that our mind is within our control,
Mhm.
and we even sort of believe that our emotions are within our control, that we can, just think positive, for
Yes.
example.
Yes.
And so I saw a great sign at my doctor's office about some of the diagnosable mental illnesses like depression and anxiety. And there was like a graphic with a person on a dock with a fishing rod and
Mhm.
somebody in the water drowning. And the caption was, well, it's just water in your lungs drowning, you know.
Mm-hmm.
But you would never say to somebody, it's just what if you're drowning, oh well, it's just water in your lungs, just get the water out of your lungs. But you'll say to somebody who's depressed, well, just get over it, just think positively.
Mm-hmm.
Right?
Yeah, I love that picture. That's such a good way to put it. Yeah. And I think that's one of the reasons why, defining it and the conversation that we're having is important, because, I don't know about you, but I see a lot of attempts, just like with that, to, if someone is struggling with something that would be perhaps under a diagnostic criteria of depression or anxiety, that, the temptation would be in different arenas for that person to be told they just need to change their mindset, or they just need to, go outside a little more often. Not that being outside can't help with depression, but there's a simplistic answer to something that is way more complex. So, the definition and the continuum to keep in mind is important, because it's a mindset trick, just go try this supplement, or it's just your mind. You need to think more positively. You need to do your affirmations or mantras. That is not an appropriate intervention for someone who is, further down that continuum. But again, we want to lump it all into one thing, and a lot of harm can really happen in that situation,
Right.
As well.
Yeah, it's really it isn't prescriptive. It's not
Mm-hmm.
a one size fits all, and that's why when you're dealing with your mental and emotional wellness, it's really important to work with a professional who's trained in the domain of mental and emotional wellness. And the interventions vary across the spectrum, so that a person who's got a diagnosis of severe and persistent mental health disorder requires a different level of intervention and support, a different kind of team, a much bigger team than a person who's here who doesn't have a diagnosis and who's maybe just struggling with their emotions, or struggling with because they're under high stress. And when you're under high stress, of course, your CEO self, your executive functioning is less available to you, right? That's like a normal. It's what we would expect to occur when you're under stress, and what works there is very different from what works in other places and for other individuals, because mental and emotional well-being is so complex in its etiology, right? In the causes, it's not one single cause. And 5 people can go through the same thing and have different health and mental health outcomes because of their whole how everything in their personal experience comes together in them. It's like different across all the people.
Yeah, they're all puzzle pieces, and all the puzzle pieces are different for each person. It is biology, it's environment, it's systemic, it's situational, it's how you were raised. It is so many different things that come into play when it comes to your mental and emotional well-being. And then what the opposite of that might be for you, the intervention for you may look very different than someone else. And as you said, it's not prescriptive. And, it's thinking just about, the fact that people have COVID anxiety, right? That's not pathological. I don't think I would sense, it depends on where they're at on how impactful it is to their life as to how we would intervene there, right?
Yeah.
But it's normal to be concerned about a pandemic.
Yes, it is 100. I'm in agreement with you that living in a global pandemic where your health is at risk, or being in any situation, pandemic or no, in a workplace where there's asbestos in the walls, in a workplace when there's mold in the building, in like, I'm just trying to think of like common examples, but they're not coming to me, so I won't waste our time. But our organism is set up to respond to threat with a stress response, a sympathetic nervous system response, aka fear or anxiety. And the purpose of that response is to mobilize our resources to respond to what's happening.
Yeah.
So, like, faced with COVID, for example, it makes complete sense that a person would feel activated. We call that anxious, but it's the way we are built to respond in an activated way when a threat is perceived.
Mm-hmm.
And you and I are in agreement that the existence of a virus that is not yet well understood and has severe health impacts, that it's normal to feel fear and anxiety around exposure to that.
Yes.
And what I think is also part of the beauty of the fear response is, like, to bring this back to business. In business, part of our work is to recognize what are the risks.
Yeah.
And our work as entrepreneurs is to identify, like we do a SWOT analysis, right?
Yeah.
Strengths, weaknesses, opportunities, threats.
Mm-hmm.
And we would be remiss as business owners if we didn't, on purpose, go looking to understand what the risks are, because then the risk comes and our business is under attack, under threat, and our business suffers as a result.
Exactly.
Our work as entrepreneurs is to identify the threats and take steps to mitigate those risks that we're facing.
Exactly.
And
it
so
sounds so healthy and normal, doesn't it?
doesn't it?
Dare I say normal?
And so, of course, as human beings, we want to identify the risks to our existence, to our health, to our well-being, right? And we want to understand what the risks are. And then we want to understand how to mitigate our risks.
Yes.
So, of course, we're going to feel anxious. And that's actually, in my opinion, a good thing until it's not. So when does it become not good?
I think it becomes not good when it's the only perspective, it's the only lens in which we look at something, that it shuts you down as opposed to motivates you into action to handle, put plans in place and strategies. When it takes you out of being resourced to handle the thing, to make the plan, and puts you into a, like a freeze response where you can't function, and you lose that ability to be the kind of the captain of the ship, so to speak, because that's what your job is to do, is to look at the horizon and assess the risk, make a change, point it in another direction, shore up everything. And if we're just looking at it, if we've gotten to the point where we can't make those decisions, we can't function, we can't delegate, that is when it's becoming problematic. That is when an intervention is needed, because it's no longer a productive and healthy reaction.
Right. We flipped our lid entirely and are running purely on, I should explain why I do this. This is the hand, what's it called? The brain in the palm of your hand. It's from Daniel Siegel. So if you imagine this is your spinal column, this is the back of your brain. So it's the reptilian brain that has the automatic nervous system functions like heart rate, blood pressure, digestion. Then we have the midbrain, or the mammalian brain, that has, for the purposes of this discussion, many components, but in particular the emotion center and the memory center. And then we have what we could call the our higher porpoise, this human aspect, and this is what distinguishes us from mammals, that we have this executive functioning, what I call the CEO self, that helps us be creative, solve problems, take action, all those kinds of things. And so when the fear comes to a point that the amygdala, the emotion center, gets so hot, it's like boiling water in a pot, right? It boils so hard that we flip our lid and we lose access to all these capacities, like you said, and we run purely on emotion.
Yes.
And we become frozen and unable to act, either in our business or with respect to COVID fears or any kind of fear. When we are unable to take action, we are unable to respond, then we need some care.
Yeah.
So what kind of things, like what kind of things, you know, when your lid is not flipped, we've talked about a SWOT analysis and making plans to mitigate, but what would be appropriate once we've crossed the line and can't function anymore?
Yeah. So when it comes to you, I always, it's kind of like your business is running you instead of you running your business. Yeah. Support, because as you always say, we're stronger with support. Sometimes we need someone to step in to provide a targeted intervention, and just to hold space for the fact that you have flipped your lid, and that is not something to spiral out into shame around. It could be that you need like a medical intervention at that point. Medication could be needed. So you need to build your team around yourself at that point, but also allowing yourself to have it, which I think is very difficult for entrepreneurs and business owners, is the allowance of the continuum.
Can you say
wherever you're at.
why is it so difficult, do you think?
I think that, again, it's societal expectations. There's a lot riding on it, I think, when we start a business. There's this, just pull yourself up and do it yourself. And that narrative around being a small business owner or entrepreneur is also reinforced, that you have to be scrappy and in it at all times, and that it's there's something wrong with you if you aren't always in that energy. And it doesn't, we don't see good representation of what that journey looks like. And you and I were talking about the fact that we've both been on that continuum in our businesses and in our lives. And you don't really see people talking about it that much, or showing transparently what it's like to still be, you're not a business owner or an entrepreneur if you're still dealing with some of these struggles. It's not an either or. It is, yes, you're a business owner who's who is feeling less resourced around their mental health and well-being at this moment, and it's still okay.
Yeah. So I'm grateful that you brought that up, because I think it is really important. Certainly for me, over the past, I would say, 24 months, not even including COVID. The main thing, and folks have heard me talk about this in other forums, but the main thing was that I had arthritis in one of my hips, which prevented me from walking entirely. And like my emotional journey around what it was like to be unable to walk for that period of time and waiting for the surgery. I had a mood disorder. I had clinical depression. And it affected my behind the scenes in the business. It didn't affect my revenue. It affected my plans and my projects for the future. It affected my enjoyment of the behind the scenes stuff, in my enjoyment of the business aspect of the business. It meant that things went more slowly than I wanted them to. It meant that the most fun thing I wanted to do, I did not have the capacity to do, because with less capacity, I focused more on the priority aspects of the business. And it did mean that because a lot of my capacity was taken up in the business, I did not enjoy much of my life over that time period. And that's kind of like, I was sad.
Yeah.
Actually, as I'm saying it now, I'm really feeling, so I'm just going to pause. To acknowledge the depth of sadness that I experienced for an extended period of time, and the losses also associated with that, the things that I've just talked about, that how I was affected, which having to kind of scale back on things, that is a loss, right? And it has an effect as well. And this is a perfect opportunity and a perfect forum to discuss to be transparent about that. I struggled, though, as a mental health professional with communicating that
Mm-hmm.
while it was happening, because my frontward facing communication is intended to be in service of my audience, if you will,
Okay.
right? And so I couldn't figure out a way to be transparent. I mean, I talked about it in podcast interviews and things like that. When I was in conversation with folks,
Mm-hmm.
but like the static stuff like Facebook and Instagram and newsletters, I didn't find a way to communicate that in a way that would serve the people consuming my content in those forums.
Mm-hmm.
And I continue to feel uneasy about the curated nature of even my stuff,
Yeah.
my static stuff, my static communication in that period. And what was it like for you when you were going through your stuff?
Yeah, it's like I'm hearing you around, you know, that expectation of curation of the work while you're in the work in a way that doesn't feel as resourced, and where that line of transparency is, and in service to the people that you want to work with, or who look to you for guidance, or that's a hard one. It's a hard one. I think that there's two things that come to my mind around the journey that I was on. When I started my business, I was full on supported by coaches, right? My mental health and my mental and emotional and cognitive well-being were very different at that point. So I was appropriately and successfully supported by some coaches, some really great coaches. But after having breast cancer and starting a breast cancer journey in 2019, and then immediately going into COVID, and the loss of what that meant for not only my business, but for the celebrations that we thought we would have once cancer was over, were all shut down by COVID. And I continue to be, I'm a high risk person when it comes to COVID for other health reasons. So it's continued to make my world very small. And so there has been loss and grief in that process. There has been, with the business, there has been the loss of the growth aspect. I feel like I'm on the other side of that now, but for 2 years, there was no growth. It was all just status quo, right?
Same.
Maintain it, maintenance, do the work, do what you can to take care of yourself. So a year ago, I switched. My need was different. So I switched from the supportive coaches to a therapist, right? Because I was on a different place of that continuum, and the interventions that I needed were different. Went on an antidepressant, which I had not been on in 15 plus years. Felt very proud about. And now I'm just as proud to still continue to be back on one again, because it helped me. Because that was a lot. It was a lot to carry, being a business owner, dealing with COVID, recovering from breast cancer. It was too much. And, all of the tips and tricks and all that was not going to work for me at that moment. And so getting the appropriate support has really made the difference. So I did lose revenue last year. I did lose the cognitive ability to really be present. It was very impactful.
Mm-hmm.
And so, again, I still see that as a normal journey for myself. I don't think that the shame spiral that, a lot of the people that I work with who have so much shame about being on that continuum, kind of that roller coaster ride, as you say, that there's something wrong with them. I don't think there's anything wrong with being diagnosed as clinically depressed after going through breast cancer treatment in 2 years of a pandemic that has impacted your life, your relationships, your business. Nothing wrong with that, right?
It's a normal reaction
Yes.
to abnormal circumstances.
Exactly.
It's exactly what we would expect. I use the analogy with clients that if you cut yourself with a knife, you expect to bleed.
Mm-hmm.
And if you're not, that's your body's attempt to heal itself. And if you cut yourself pretty deeply and don't bleed, you're going to be like, whoa, that's weird. Something's not right.
Mm-hmm.
So if we would expect to bleed when we cut ourselves, would we not expect to have depression, for example, after experiencing a series of adverse circumstances?
Yeah.
Of course we would.
Mm-hmm.
Yeah.
And yet there's just so much, there's just still so much fear around that. And there's still so much a need for, masking who you are and what your experience is. And you're holding so much as a business owner. You're holding so many things, and you're wearing so many hats that you are going to be on that continuum at some point. You're going to be there, whether it's anxiety, depression, situations that you can't fix that impact your nervous system, because sometimes there's not a solution that it's external. It is about supporting your nervous system the best that you can with this situation and an external thing that you can't control.
That's right. Because you can't, like I said before we got live, you can't make shitty shit be not shitty.
Exactly.
Right. And so the question is to get resourced enough so that you're getting care in the midst of this shitty situation.
Mm-hmm. Yes. Yeah. So the one thing we don't need you to do as a business owner, leader, or entrepreneur is to hold your need for care against yourself.
Yes.
Right. Don't do that. Don't do that. It doesn't help you. And it doesn't help the people who look up to you as a leader either, to see you not supporting yourself.
In the self-compassion research, Kristen Neff talks a lot about common humanity.
Mm-hmm.
Right. And that's really such a healing thing, the common humanity, for our own selves to have a sense of like other people feel this way too.
Yes.
But to also provide that validation as a leader for others, that when they see you, when you are as transparent as you feel comfortable with around your humanity, that humanizes for others what they also are going through. And what's the word I'm looking for? Well, to speak colloquially, it helps people know they're not nuts.
Yeah.
Honestly, a lot of people come to me concerned that they are.
Mm-hmm. Same.
Yeah.
You're not.
It's completely normal to have mental health challenges.
Yes, you're a human being living in a messy world.
Oh my goodness, so true.
Yeah.
So we're at the end of our time together today. Is there anything you'd like to say to close, Nicole?
I feel complete. I feel that we have, shared some definitions and some way to pull apart this one idea of what mental health is. And we've had a really good discussion about this. So I think I'm going to stick and stay with my one thought of, that you give yourself the support that you need. If it's therapist, if it's a coach, if it's a business therapist or an entrepreneur therapist, there are resources out there. You do not have to do this alone. So don't do it alone.
Yeah. So click like and subscribe and share, because we'd love to have you along for the journey. And thanks for tuning in.
Absolutely. Thank you for having us.
Bye.
Bye.